RMIAN envisions a future where the U.S., at every step of the way, welcomes and celebrates immigrants, where every immigrant in Colorado receives free legal representation as a part of the immigration process.
RMIAN started really in the early 1990s as a group of lawyers and community members who came together in response to the grave injustices that they saw at the Aurora Immigration Detention Center. And it was really about providing legal representation in that context, because then, as is still the case now, there's no right to court-appointed counsel for anyone who's going through immigration proceedings. But one of the things that became clear pretty early on was that while the legal case was incredibly important, we also saw so clearly and heard from our clients that the legal case was one aspect of their lives, but there were so many other aspects of their lives that could use the support of our social service project and social work and behavioral health and mental health supports. And so a group came together in response to that and created what is now RMIAN Social Service Project.
Working with the attorney and educating also the attorneys about how to best communicate with their clients to ensure that they're not triggering their clients or that they're not re-traumatizing their clients is just so important. I've worked with both adults in detention and youth in detention, and really just helping build that rapport even with the first meeting, right? And so really making that connection then to the service provider that's going to be providing the legal support. I encountered a lot of youth who didn't believe attorneys and didn't believe what they were saying or that they could help them because they had been failed so many times. And so starting to build even from that, right, with clients was really important, particularly for the legal case. I found that a lot of times clients have told me things, very vulnerable things about their symptoms, their mental health, things that have happened to them that they haven't told anyone else. And so to hear you're the first person that I'm telling this to is so powerful.
When a judge identifies somebody who is experiencing mental illness in a way or cognitive symptoms in a way that prohibits them from representing themselves in removal proceedings, they get assigned counsel. When I'm working with clients who are experiencing mental illness or potentially are experiencing particularly cognitive issues that are prohibiting them from representing themselves, one of the first things I do is that I reach out to my social work colleagues here at RMIAN to ensure that the two of us can work with that client together. Because I have skills and experience that the social worker doesn't have. The social worker has skills and experience that I don't have. Therefore, hopefully together as a team, we can meet the client where they're at better in order to work with them to try to represent their case.
It's been tremendous for us to have the support from Caring for Denver. It's allowed us specifically to provide social work and social service support to our youth. Our staff will tell you, our lawyers will tell you, that being able to provide both, expert legal representation as well as have dedicated social workers connected to clients' case makes all the difference.